Mary Seacole was born in 1805 in Kingston, Jamaica. Her mother was a free black slave and her father a Scottish man. Her mother was a doctor who was skilled in traditional medicine and provided care for invalids at her boarding house. Mary Seacole used to work alongside her mother at the tender age of 12 and quickly studied and learned the technique of traditional medicine. In 1836 Mary Grant married Edwin Horatio Seacole, and during their trips to the Bahamas, Haiti and Cuba she augmented her knowledge of local medicines and treatments. After her husband passed away in 1844, she gained further nursing experience during a cholera epidemic in Panama, and after returning to Jamaica she cared for yellow fever victims, many of whom were British soldiers. Seacole was in London in 1854 when reports of the lack of necessities and breakdown of nursing care for soldiers in the Crimean War began to be made public. In 1855, with the help of a relative of her husband, she went to Crimea as a sutler, setting up the British Hotel to sell food supplies and medicines to the troops. She assisted the wounded at the military hospitals and was a familiar figure at the transfer points for casualties from the front. In 1857 her autobiography, Wonderful